Well, good afternoon. It is good to be with you virtually, a little bit earlier than originally planned, but I'm happy to share some thoughts and some experiences that might help with enhancing both influenza and COVID vaccine uptake. So we're going to talk some about what is hesitancy and what drives it, what is vaccine confidence, what do we know about some of the factors that um, predict influenza vaccine behavior, and most of which are absolutely relevant and in play right now with COVID. How might you answer some of the common questions we hear from our community members, and what can you do to make a difference? So let me start with vaccine hesitancy. We hear that term used a lot. And part of why I think it's just important to share it is hesitancy is not necessarily refusal. It may be a delay in acceptance. It may be refusal, but it's predicated on having availability of vaccine services. It's complex. It's often dependent on what vaccine we're talking about. And then it also includes things like complacency. So how important or necessary do you think the vaccine is? Convenience, cost, and how easy it is to literally physically access it, and confidence. And we're going to talk about that in just a moment. Confidence speaks very specifically to safety, your belief in safety and effectiveness. Vaccine confidence, which is what we want, it's what we're building toward, is really about trust in the effectiveness and safety of the vaccines, the system that delivers them, the reliability and the competence of health services and health professionals, and the motivation of policymakers who decide on the needed vaccines. And we're going to come back to some of this a little bit later and talk about it in the context of where we are today. So we see in the press a lot of discussion about hesitancy, and there are many groups that may be skeptical, may be hesitant, or might continue to refuse, but their reasons may differ some. For African Americans, who have experienced a history of both and not just a history, but even today during the pandemic, we have seen examples of differential treatment of Black patients coming into a hospital. There's certainly the legacy of Henrietta Lacks and the legacy of the Tuskegee syphilis study, but there's also the ongoing context of racism and people feeling like they've not been treated respectfully, especially in healthcare. For Latinos, whether documented, whether naturalized, all of, or not, there can be fears about encounter with immigration for themselves or effects on families. Younger people just think that, they're impervious, they're invulnerable. That's, something we've always known about, those that are younger. But we're seeing increasing focus right now about with rural and white Republicans and evangelicals who have also a different set of reasons. It may be distrust in government for some. For evangelicals, it may be faith, that they believe that God will protect them when they don't need the vaccine. So the reasons for different groups sometimes being skeptical or initially reluctant or even refusing may vary, but trust is frequently a concern amongst a number of these groups, but for different reasons, depending on their background. So I'm going to walk you through some of what I have learned in both CDC studies, I've funded studies, NIH funded studies. This was a nationally representative survey, and you can see over 800 each of African Americans and whites. This was predicting flu vaccine uptake, but it's important today. So we know that the higher disease risk, the higher uptake. However, frequently what we find is African Americans in particularly perceive a higher risk of vaccine side effects. And we know that as perceived risk of vaccine side effects goes up, intake goes down. So we'll talk about that in the context of COVID. Social norms make a difference. If you believe that people close to you, people who love you, want you to get vaccinated, then that increases your likelihood of getting vaccinated. What we also found that was particularly interesting with African Americans who got vaccinated every year or most years was they had a stronger belief that it was their moral obligation to others to take the flu vaccine. And that is something that may well be important for us in the context of COVID. Trust in the provider. So providers are critically important. Whenever you ask anyone who do they trust most for health information, they say their doctor. Now, they may not see that doctor routinely, but that's who they think of first. And so the importance of the recommendation of a provider to a patient cannot be underestimated. And finally, knowledge. Knowledge never fully just predicts behavior, but it's important. And it's knowledge of the vaccine process. We'll talk about that. It's knowledge about the recommendations. Those things can help make a difference. We found that people didn't fully understand the flu vaccine process, and now we're in the midst of a whole different process with COVID, right? So we created an infographic. We tested it before we used it, really walking people through the process from selecting the strains down to who puts the vaccine in your arm. And what we found was that African Americans had lower trust in all the organizations, but their rank order was the same as whites. So their doctors first, CDC, FDA, and the one thing everyone seemed to agree on was they were not very trusting of pharmaceutical companies. We also know that the higher trust in the vaccine itself and in this process is associated with higher vaccine uptake. So this is critically important now that we're in a space where we've been watching clinical trials and emergency use authorization. You know, what do people know and understand about that process? So just finally, with hesitancy and confidence, we certainly found that that trust in the flu vaccine was positively associated with convenience and confidence, and negatively associated with complacency and hesitancy. That sort of makes sense, right? And that we know when people had higher confidence in flu vaccine, they were more likely to take it in the season we ask and in the past 5 years. So that's what we're working toward, is how do we help people become more confident in both flu and COVID vaccine? So let's talk about what some of the common questions are people have about the COVID vaccine. And this is from our work in particularly African American communities and with colleagues in a study who are also working in Latino communities. Certainly one of the questions is about the timeline. How did it move so fast, and did it cut corners in terms of safety? And there are some really simple things that helped. Obviously, we invested in enormous amounts of money, and that was on the table up front. People didn't have to seek funding over time. We used existing clinical trials networks. So these were people who already knew how to do vaccine clinical trials. FDA and the CDC prioritized the review and authorization recommendations from the beginning. So FDA started working last spring 2020, early summer, with Pfizer, Moderna, Johnson & Johnson, et cetera, on their submission of all the pieces that would need to go into their package requesting authorization, including they even did some of their inspections of manufacturing plants, those kinds of things early. We also didn't wait for the end of the trials to start manufacturing. That's why when it was authorized on a Friday, we had vaccine rolling out, over that weekend and early the next week. The other questions related is was there political influence And there were 3 independent committees that were part of this from the beginning. The Data Safety and Monitoring Board that reported to NIH, not to Pfizer, not to Moderna, not to any of the companies, and that met weekly and reviewed all the safety and efficacy data from the trials. The VRBPAC, the Vaccine and Related Biological Products Advisory Committee of the FDA, is an independent body. And then finally, the Advisory Committee for CDC on Immunization Practices. And, bottom line is particularly mRNA vaccines are faster to produce. Particularly, African Americans that we work with, Latinos, and older adults say, were there people like me in these trials? And was it safe and effective for them? And while these trials did better than many clinical trials on recruitment of African Americans and Latinos in particular, it still wasn't great, but it was better than we've seen in the past. And we certainly saw that there was adequate representation of older adults. The bottom line was there was no difference in safety effectiveness by race, ethnicity, or age group. But there are also a lot of myths floating around. The mRNA vaccines will alter DNA. That is not the case. That it will give me COVID-19. That's a very familiar refrain from the flu vaccine. And of course, that is not true. It's brand new, experimental, never been tried. And actually, there's been a lot of research on the mRNA vaccine platforms for a number of years now. This is the first time we've seen an authorization, on this scale of mRNA vaccines, but it's not new. It will affect women's fertility, and that's particularly an issue, in communities of color. It's an issue with younger people, but it is not, there is no evidence to suggest it affects fertility, and that it contains fetal tissues, microchips, or other devices. That is not the case. We also, there's concern about, well, how do we know it's safe? And I'm going to talk about that in a moment. The clinical trials are still ongoing. So even though the authorizations took place and Pfizer and Moderna will shortly be requesting a standard biologics license approval for their vaccines, the trials actually are still ongoing and continuing to monitor safety and immunoresponse, now, at least 6 months out from an original recruitment and vaccination, and they will continue 18 to 24 months, I believe it is. The US and globally, certainly have a number of existing and new mechanisms. I have a little typo there, assisting in new mechanisms to monitor safety. And it's in fact the pause in the J&J vaccine distribution right now that is really reflects what's going on. There is enormous scrutiny of what is happening with these vaccines across the world. And it is in fact that scrutiny that enabled, the identification quickly of the 6 cases of blood clots in women associated with, caught in terms of time, associated with the J&J vaccine, associated with temporally. We do not know if there is a causal factor here, but the point is at this point that FDA and the Advisory Committee for Immunization Practices and CDC said, we take this seriously. We're going to pause until we can do further research. And that's actually a good thing. That's a sign that the system is working and taking it seriously. So what do we do to increase trust and confidence, and how do we increase uptake? And one of the things I would say is, if you watch national polls and One that I watch routinely is the Kaiser Family Foundation, is we have seen across all these polls a decline in hesitancy among African Americans, a group that I'm working with right now, um, and a general decline. That has not been seen so much with white Republicans still, but there is a general, there is an increase in the willingness and to get vaccinated. So I think there are a couple of ways that's happening. Number one is certainly that there's an enormous effort that has been happening, and we've been part of it working in Black and Latino communities here in Maryland and even nationally on how to help people understand more about COVID-19 itself, the vaccine process, and then the recommendations. And, let's face it, I mean, many people, not just the public, but many of us had a crash course in clinical trials, right, over these last couple of months. And so we have been doing ongoing work. We work with Black barbershops where early on last spring, last summer, even in the fall, we were hearing a lot of people saying, no, I'm not going to get it. No way. I don't want to be a guinea pig. And we have seen that shift. Our barbers and stylists we work with are now all vaccinated or in the process having one and waiting for their second. And their clientele are changing. We've also done a lot of community forums online where we have community members, providers, policy makers at the local level, all talking about the vaccine. And so we believe that has really, made a difference. Talking about perceived risk of the side effects, which, at this point, what we know is for most people, those side effects are mild and transitory. They may have a sore arm, they may feel tired, they may feel achy, they may not feel great for a day or two. But the perceived risk, and I think here we have to talk about the role of the vaccines in reducing risk for severe disease, hospitalization, and death. That's huge. And then the corresponding importance of still considering perceived risk for the disease itself, because even mild or asymptomatic disease can result in long-haul symptoms. It's nothing to play with. Finally, remember I talked about norms for a moment, and that's one of the things we're hearing from community members as we're doing our interviews, is that it's not just about taking the vaccine to protect themselves, it's about others. It's about one of our barbers saying, I've got kids, I can't get sick, I need to support them. Another person saying, my mother is 79, I need to be able to care for her. So there are collective benefits and individual benefits. So what's the role of healthcare providers? So when you hear hesitancy, when you hear people who are concerned and have questions, I think one thing is to be empathetic. I mean, this is complex science. It's emerged quickly. So, many people may have questions. That doesn't mean they're going to refuse. And I think the more we can give them the opportunity by telling them it's okay to have questions and engaging in a dialogue about those questions. I think the other thing that's really important, and it's hard for people to understand that even this far into the pandemic, there's still uncertainty. There's still things we don't know. We're still monitoring safety. We're still monitoring to see how long the immune response lasts. The only way to know that is to have time pass. And so that's hard for people to understand. But I think acknowledging what we do know and what we don't know and preparing them for things may change. We may find we need booster shots. We may not. But in some ways, only time will tell us the answer to that. I think being ready to address the questions about safety and efficacy, particularly if you're working with older adults, if you're working with racial and ethnic minority patients and populations, and being able to help them assess that balance between disease risk and risk of side effects. I think that's really important. Often as providers, we talk about disease risk, but we may not engage with, helping them sort of assess what's my risk? Am I out in an essential job? Do I have a chronic disease that puts me at risk? A number of those things. And, for most people, what are the common side effects we get? So I think another thing that's really vitally important, remember I said the trust in providers is always the first thing. It's so important. And being a role model makes a difference. Taking the vaccine yourself makes a difference. And I know in some healthcare setting, there has been reluctance by staff. And, that will require ongoing dialogues in-house to begin to address that. Make a strong recommendation. And, one of the possibilities is making a presumptive recommendation, as opposed to do you want to get it? But to make a strong recommendation. And we're talking a moment about how to do that. So one of my colleagues has proposed a GIST communication framework. So it starts with really an evidence-based fact or statistic. So for example, we know the vaccine had very strong safety data and that side effects are short-lived, like sore arms, tiredness, minor side effects. So if we know people may be concerned about side effects, that might be a piece of data you want to use. An explicit link, so, that connects that verbatim statistic to just what you really want them to walk away with. And this is really bringing it home to them. So the reason that's important to you, Mr. Jones, Ms. Smith, is that with your type 2 diabetes, you're more likely to have serious complications if you get infected. The vaccine is effective in reducing cases of severe illness and hospitalizations. So you're speaking directly to their risk of the disease and to their personal, you want them, the reasons important to you, what I want you to understand, what this means for you, those kinds of statements, bringing it home to them. And then finally, just, to help with comprehension, to really sort of make the point and to help with recall. And this is where I think you have room to say, I took the vaccine itself. You may even feel like, I recommend it for my family members who have diabetes. I strongly recommend that you take the vaccine today. And what's even better is when you're in the position to actually give it. And so it becomes, I strongly recommend that you take the vaccine today, and I have it here in the office to give to you. So providers play a vital role in this process, and addressing trust, addressing safety, effectiveness, perceptions about risk. And I think remembering, and I haven't spoken to it here so much, but you may also know when somebody has, an elderly parent that they're caretaking, and you may also be able to speak to that desire, that norm of taking the vaccine, not just for yourself, but because there are others who depend on you, others you love or care about that will need your assistance. So, I want to thank all of you for what you do to protect the health of your communities, your patients, and we're in this for the long haul. COVID is going to be a process, and addressing vaccine skepticism, hesitancy, questions will be ongoing for a while now. So I wish you good luck, and I hope that this was helpful in providing you with a few tools to make a difference. When we send these slides in a PDF, there will also be a few resources here that may be helpful to you as well. So thank you very much.